we do have with us, this is Pierre.
Hi, yeah, I'm Becky Arnold. I'm just sitting in for today.
Good to have you. And we also have Samantha Matthews, who is shadowing Patrick for the day, so it's good to have you as well. So I've done my welcomes and introduction, but I don't think there's anybody around the table where this is their first board meeting. There's no further introductions. Apologies for absence. We have Vincent, we have Kat. That's it, isn't it? There's nobody else that's missing. Brilliant. And are there any declarations of interest in relation to our board pack today, our agenda today, that anybody needs to declare? That's yourself. Yes. Okay. And then if we look over to the minutes of the meeting held on the 5th of June, and if I just kind of ask, are there any points of accuracy or amendments or omissions that people want to draw my attention to? Okay, and then the matters arising, there's only one thing that it's not necessarily on the matters arising, but just I'll just check with Dave really. It was just on the finance report, I mentioned about SIP, the concerns about unidentified savings. I think you advised that report will be discussed by executives next week. So this is the last board meeting.
Okay, we have had several discussions since then about we have had regular discussions about people. I think we're also going to be talking about it this next Monday, and we've asked for additional savings schemes to come through with people, so we talk through about it. But it is a real intractable problem.
I thought I would just raise it there because it was mentioned in the last board, but it wasn't an action. And then the quality improvement report, board members were asked to comment on the engagement plan directly, and that was completed. And also the trust strategy update, the board approved the strategic goals for 24-25. Brilliant. Okay, so moving over to executive board.
Thank you. I'll take the report today, but just a couple of things that I wanted to highlight, and then at least one thing I wanted to talk more about that was in the report. So from a people point of view, you will note in the report and also in our committee report as well, that both from a recruitment and vacancy point of view, so we've continued to undertake our recruitment and our vacancy levels are continuing to reduce. Lots of different opportunities being taken, and that's happening across the board. We're also seeing that our turnover rate is also reducing over time, so there's something about the work that we are doing needing to sustain doing that. The levels of agency usage have come down significantly, and we're continuing to work on doing likewise with the bank. We will see the periods of industrial action, majority of those are now coming to an end, given that the new government has made the announcements around the pay volume reviews, but also the negotiations they're undertaking with the VNA in particular. We are though in a situation whereby GPs are taking industrial action, really around working to rule, and you'll note from the report that we are working collectively across Birmingham and Solihull to consider what the impact of that might be and how we work together to mitigate some of the risks that will inevitably result in. I think from a colleague point of view, people are very pleased to see that the pay review body's recommendations are being taken on board. I think there's been quite a lot of concern about the time lag around this. We have yet to receive information about when they're being payable, but I would hope that we would be in a situation where financially things will have been sorted so that we can pay. I might be held wrong by that, but that is a personal view, but I think that's where we're going to get get to. We've recently launched across the Trust the third phase of our No Hate Zone, our NHZ campaigns, and our newest campaign is around disability work for us campaign. So there are a lot of these leaflets around the Trust. There's also an opportunity to sign up to the pledge online as well. As a board, we will all sign up today. We've all got our pledges ready to do so. And I would commend anybody who has contacted with Trust to sign up to the pledge as well. From a sustainability point of view, we'll obviously hear a little bit more about the financial position during the meeting. Just suffice to say that our financial position is pretty much on track and on plan for where we want it to be, and that has taken a huge amount of work, notwithstanding the point that we made about efficiencies and savings. We have managed to fulfil the commitments that we had wanted to at this moment in time. From a mental health provider collaborative point of view, just wanted to highlight the work that's being done around children and young people and transformation and looking at the model of care. That is coming to some conclusions, so we will over the coming weeks be having more discussions about the conclusions that has come to. Likewise, we have put in place, and you'll see from the report, and you'll remember that last time we had our commissioning committee, we met with Richard Kirby, who is the lead for the learning disability and autism work, and equally the health needs assessment and the development of our strategy is now underway, ready to support that being available to launch across the system in April of next year. From a quality point of view, just a couple of things I wanted to highlight. One was that since we last met, we have had a CQC report for our eating disorders service at St Andrew. That was a focused inspection following some concerns being raised. I'm really pleased to tell the public who don't already know that that resulted in a good rated report. And whilst I understand that there's a lot of national conversation about whether the value of the CQC reports, the reason I want to mention it is that a lot of the narrative in the report is based around what staff said, what patients said, and what carers said. And that really isn't about an assessment, that's about what people actually said about the service, and there's some really good feedback from that. So I think the service can be very proud of the impact they are having for patients and the support that they are giving carers while their outcomes are being taken. Lisa also arranged for us during last week for Oliver Stanley to visit the organisation remotely to undertake a learning from Greater Manchester reflective practice session, and we will hear more about that as a board as we go forward as those reflections turn into actions and for us to take as an organisation from that learning. From a point of view of other things, I just wanted to commend to the board, if you have the ability to read the NMC independent inquiry reports, it is a tough read. We have done taken some immediate actions to ensure that anybody who is a colleague in this trust who has been referred to the NMC, that their wellbeing is taken care of. So that work has already happened, and we will be doing some wider work around the cultural pieces that came out of that report, and any reflections we have around our own culture and what we may need to do in line with them. I wanted to talk a little bit about, just to remind the board that we had our Expert by Experience recognition event a couple of weeks ago. It was, by all accounts, a really lovely event. I can see people who were there smiling around the table. But this was an opportunity for us to acknowledge and recognise the contribution that Experts by Experience, like Maxine, who we heard from earlier, give to the organisation, that giving back. And I know Mustak, you had a particularly good day as part of that. And it was an opportunity for colleagues to really recognise the work that they do. Thank you. I wanted to thank publicly our IT support staff. We've had a global outage People will remember several weeks ago, and thank you to our IT colleagues who rallied, not just on the day, but actually had done a lot of work to keep us safe prior to that. And so actually the impact for us was relatively minimal and was sorted within a few hours. And then finally, on the celebration point, I just wanted to, you'll note a couple of places in the report, both in the clinical services element, which Vanessa will come on to, but also in that more general update, that as an organisation we have been shortlisted for a number of awards in the coming months. So we look forward to the outcome of those, and thank everybody for the work that they've done to enable us to be in that position to be shortlisted. And I'll hand over to Vanessa.
Thank you, Roisin. So, talking in a bit more detail around clinical services, as ever, I always start with saying there's a lot going on. There's definitely a lot going on. I'm squeezing it into a few pages to try and sort of articulate that. Lots of celebrations in there, so, to acknowledge that. I think it's really, really good. You can see improvements across all the divisions, people feeling really, really positive around the improvements that they're making. So it's, that's really, really pulled out in the report as well. We've done a lot of work also around health inequalities. I wanted to acknowledge that in the divisions. Again, probably too much under the radar, just really trying to pull it out. So some comments there, but I think, maybe next report, just trying to pull out some of the data that's behind that and actually, what we actually are celebrating and what are the improvements that we can see and that we're making. So we have 4 divisions, as you know. I'm just going to go through very quickly, just pulling out a few elements from each of the divisions. So I want to start with our ICCR, which is our Integrated Community Care and Recovery. Again, following CQC visits, there was, noted some poor sort of standards around medicines management. So a big piece of work that's taking place now across all of the community mental health teams, looking at improving the standards, pulling together prescribing standards, and also looking at safe and secure management, in particular around prescriptions. Big piece of work around that, and again looking at auditing to make sure that those standards are implemented. So I wanted to actually acknowledge that work, which is across all of the community mental health teams, as I've said. If I move us on to steps to recovery service, which are our longer stay rehabilitation wards, they again are focusing around quality standards and also around peer review. They've got a process that they're going to be implementing across the different units that we support. They've got working on a co-production strategy also, looking at different ways of how they're going to be considering and acknowledging and addressing some health inequalities across the division as well. Also wanted to note that the community rehabilitation team, or the intensive community rehabilitation team, the ICRT, so yeah, get rid of that acronym. We had a talk at our QPES, so our Quality, Safety and Patient and Safety Committee last month. One of our staff around what that team is doing and the benefits that that new team is bringing by bringing people from placements out of area and supporting and preventing people going to more longer term rehabilitation services. So they're doing some absolutely great work there, some great clinical outcomes, as well as some additional savings that we can reinvest into more teams. So that was really, really positive to hear that work. If I move us on to secure and offender health, our first paragraph there in the report, for those you can see, talks about the CAMS service, so our children and adolescent service, and the great work that they're doing there around writing articles around what it's like to be in a secure service as a child. Had positive feedback around accreditation around the autism work, and also we're doing some work around LGBTQ plus awareness for younger people, which I think is really, really important, probably sometimes under the radar in our organisation. As the executive sponsor for our network, we're really proud that we're actually doing that work over there, so it's great to have acknowledged in this report. The Forensic Intensive First team, again, continue to do their quality improvements, and they've got to establish their own actual forum to look at these improvements. Good to acknowledge that. Lots of quality improvements going on around the different pathways, and also they've acknowledged a significant improvement in their staff survey results. Again, really, really coming together, supporting each other, and we're finding more people now are contributing to the staff survey results. So that's really good to actually acknowledge that and to see that That work will continue. Also good for the first team that we've identified capital funding. So we have, and I reported here, month on month around not having a great estate, not having a team where they're space where we come together. So we've got investment there for a main house. So that's really good to acknowledge that. So it's actually finally happened. I'm not quite sure we're going to put the start the work, but it's good to acknowledge it here. I know I've reported previously around psychology. We've had lots of psychology vacancies in the division, but now we've filled most of those vacancies, and there's only 4 which are out to recruitment. So again, good work around recruitment, which Rasheen's also acknowledged around that in her report. We'll move to acute and urgent care. I don't know the page. Again, lots of work, and we always acknowledge the work around our inappropriate out of area. Big sort of pressure for us both financially and from a patient experience and recovery perspective. We still have our plan around productivity with 4 areas that we're focusing on, which we'll come to in more detail when we talk about our integrated report, particularly around finances and inequality. But to acknowledge that we had quite a good month in June. Lots of people who were placed out of area returned, but in July, because of pressures, we were seeing pressures from a flow perspective, and we had many people who were clinically ready for discharge that were unable to discharge. Also a lot of pressures in the ED departments across the city, which caused us having to place more people out of area, with plans to return people, but also just absolutely acknowledging that pressure that was in the system. I mentioned clinically ready for discharge. We've noted that we're a real outlier, and we've got a real focused piece of work looking at how we can reduce people's who are ready for discharge, who we're unable to discharge because of, mainly we are seeing with the data that we're collecting, move on to accommodation, move on to supported accommodation, also around probably work we're doing with our local authorities around social work allocation as well. So we've got a good group of people engaged around that, looking at how we support people and our staff, as well as our service users around that step down. We're sharing some best practice across the divisions within the organisation, also around looking at some best practice elsewhere as well, and putting that into the work that we're doing. Wanted to note also that we've got our date now for the liaison team over at City Hospital to move to Midland Met. So it's looking like it's in November, so we're heading towards that date. We've got site visits going on. We've got a really lovely space for our service users who have mental health needs outside of the ED departments for assessments, for treatment, and for follow-on care and support. So really, really proud that we've got that space there. Working great with the organisation as well as our colleagues with the Black Country. That's where we're having an integrated team with them. That would be over Midland next. Primary care and dementia and specialities. Lots of work going on again, as I mentioned last time, around wellbeing. We had a wellbeing event on the 6th of June, which we've highlighted here in the report, which was really, really good attendance. And also wanted to name check the bipolar service. We talked about the Mood on Track. They deliver that programme. We have now other organisations that are picking up that programme and rolling it out across the country. So really, really proud that people are acknowledging that and moving that forward. Lots of work going on in the memory assessment service. We've had some investments, because we know we've got some challenges there around waiting, people on the waiting list. Looking at a new system now, which has only just gone live last month, and we envisage that will release more time for practitioners to provide support and have more attendances around people who aren't actually being seen in a timely manner. We've mentioned about perinatal team and mentioned earlier just around people and the teams who have won awards. So the perinatal team really won the Staff of the Year award in our annual awards this year. And they're doing some absolutely great team. We've integrated into the team over at Maple Leaf Centre, which was really, really good to see, and working with the other teams there. And just finally, just a finishing point was we tried to pull through also some of our good news reports. So from a psychologist, we just got a statement there from one of the service users, just thanking the psychologists for their really hard work and what impact that made on their lives. So we thought we'd finish on that positive note there as well. Lots in there, lots to say. I'm always talking really quick when I speak about it. We can take any questions or any points about it.
thank you. Just hold for questions through machine learning.
Yeah, so I just also wanted to talk a little bit about what we're trying to do as an organisation in response to the social unrest that we're seeing across the country, but more specifically in Birmingham and Solihull. So people will be very much aware that there are a number of protests that have been instigated by the far right, and that is causing anxiety, concern, and fear for our communities, and our colleagues that work in our team are part of our communities. So I just wanted to give some assurance to the board about the fact that we're very mindful of that. We're very mindful of the fact that it is far right instigated and what that means, the magnitude of concern and anxiety that will cause for Black and Asian communities and our staff. We have sent out a number of communications starting during last week, and we are continuing to support locally in services when we're hearing about the potential for protests that may lead to unrest as they happen. So we are meeting both morning and evening to consider that information and to support services. We are very clear that our priority is to make sure that our patients and service users and our colleagues are safe, and that services are safe and continue to be provided in whatever way they need to be at a time that is very distressing for everybody.
Thank you, Sheehan. Endorse the communique that went out on Friday, and also again on Monday. I believe it was well thought through and put together well, and it was very considerate and really demonstrated our values as a trust, that we are definitely here to support and do as much as we possibly can in very uncertain circumstances and quite worrying and anxious times for our colleagues, our staff, but also for our service users as well, and particularly those in the community who may feel unsafe and wish to attend appointments because of the potential unrest. And also, I'm hearing that there's some demonstrations today as well in Birmingham. So it is a quite heightened situation, but she is right. There's meetings being held both at the beginning and the end of the day, and also, we are in contact with our police colleagues as well. And so, we're doing all that we possibly can in these quite uncertain and challenging times. So I just wanted to endorse that, 100% support what we as a trust are doing, we do as much as we can do. So thank you for that, Rasheen. So in relation to the CEO's report, are there any questions?
Just to provide some further assurance about cilantro, I visited cilantro a month or so ago, I guess, probably either before or after the CPC visit, and yeah, I was really impressed with the didn't manage to speak to any of the patients there because it was very close to lunchtime, but certainly all the staff who took me around were really positive. I didn't have any sort of thoughts of any concerns there. It was really positive.
I've just got a couple, just more just for greater understanding. So the NHS Professionals National Bank has actually gone live, and in your report it says it will provide an option to supply workers before going to agency with significant that's gone live. Have we utilised that yet?
Yeah, we have started utilising it. So it's more of a tier system. So previously, when we've not been able to fill the flag, we've gone out to agency. So now we have that arrangement with NHS professionals that are going to supply us with staff, which is actually still considered as part of our bank and not just part of the agency.
That's what I wanted to clarify. So on the back of that now, in the report, pushing, it says, we are using the direct engagement model for doctors, and sometimes that's where the biggest cost is, and it says that it should help to provide some significant savings of that. In what way?
So basically, as I understand it, the way it's charged through, doing this means you can reclaim the mat. So effectively, it's just a straight top slice of the cost that comes in, so it's a straight saving, etc. Is there any more?
That's correct, yeah, so we mainly save on the VAT, so that when you accumulate that over a period of time, that's a significant amount of cost.
Brilliant. And are there a lot of doctors signed up to this particular NHS professionals bank?
We've moved all our agency consultants to direct engagement.
Just been really clear, the NHS bank.
Yes. Is this on there? Sorry, it's on there. Yes, it is, yes.
So all our agency consultants have now moved to direct engagement, and the medical staff team have worked with the agencies and the doctors to do that. But even better is that many of our agency consultants are still moving on to NHS contracts with us. So overall, our agency spend is reducing and reducing.
So is that, so just to get clarity, so where's the incentive? Because previously it was a financial incentive for them to actually sign up to an agency. So what's the
So the doctors get the same or similar hourly rate, but the organisation saves on the cost of the VAT.
right?
But for the doctors who move to NHS contracts, it's because they want to work in our teams, and we are getting more doctors who are willing to come on NHS contracts. So we've also given notice to some of our agency doctors.
So there's been a long-term discussion with them, finding people to persuade them to go across. So it's not about giving the financial incentive, it's just explain the benefits. So there's been no requirement for that, and it's separate systems.
It's been a huge effort.
Yeah, that's great. My query was just around the health justice vulnerability service, now live, aiming to increase accessibility for those who have contact with the criminal justice system within a 28-day period. What benefits will this bring for us?
I think it's around the referrals and the quicker access, Chair, is what the benefits actually will be. Sort of, having a more sort of engaged team as well with that expertise. It's something that's, like I say, just going live, so again, it's just trying to pull some of the information and the data as part of that. So, they're the main sort of benefits.
Yeah. And will it have benefits in terms of psychiatric liaison team? Benefits with that?
Yeah, potentially. I mean, we're doing a lot of work around the liaison teams, again with the police, with the courts, etc., because we know we have a lot of people who are section 135, 136, so how we reduce that and how we work with the police. So I wouldn't see the team working on their own. This is how they sort of liaise and have those pathways into the other services as well, so that's a good cause.
Okay. Excellent. And then the other question, really for yourself, Vanessa, was you made reference to 4 divisions actually doing some good work in relation to health inequalities. What does that look like?
It's different in the different divisions. So all of the divisions have had data fed back to them around the areas that they work in, and they're coming together then to see around, for example, in talking therapies. We don't have many people from different communities who have access to talking therapies. Yeah. So what do we need to make sure and to enable them to access? So is it having a staff group that looks familiar with the communities that we serve? Do we have the information in the right languages? Do we have the right people who have the written information as well? So there's lots of work depending on the divisions and depending on the service. I'd say a lot of the health inequalities is particularly around access at this point in time, and absolutely improving that. And we do have some specific focuses around perinatal services, around access, and like I said, we're talking therapies as well. All the teams have a plan, and this is why individually they are actually looking at, what does this mean, for example, steps to recovery or rehab wards? What does this mean to our community mental health teams? And then we've got the rollout of the community transformation. So again, they're working more in the local communities, working with GP practices. So again, that's pulling out a lot of inequalities around age, around gender, and but like I say, specifically it's around accessing services. I don't know if you want to add to that as well, Peter.
I can add as well. So we've got all our directorates with detailed plans of individual, access experience outcomes. And on Friday we had a really good event with many of our community partners. Most of attended for a little bit as well. And it was really to have a critical friend session to just look at the plans, and the suggestions that came were phenomenal. So we're going to take that forward, meet again in a few months, feed that back to all the leads. And a lot of that was about doing more co-production. So the plans are really good, but we want even more co-production. We want more initiatives even for both patients and staff. So actually, I know it will be reported to board because it will all go to the health inequalities board and then it comes back to board. So it will be really good to see the details.
Excellent.
I mean, that was the point I was going to make, which was that we have agreed that the board will receive twice a year more detailed reports around what is happening around health inequalities.
Excellent, great.
Yeah, it was just expanding on that really, and that's sort of working with as many people as we can in terms of this sort of co-production. And induction yesterday, I was involved with Mushtaq in meeting some of our new staff, and I think she's our new head librarian, was talking about not just how we address the health inequalities, but addressing the literacy of our population, and how our documents, whether they're translated or not, if they're not designed for people who have inherent literacy problems, whatever language they speak, it still won't be meaningful to them. And that, I thought that was a really interesting contribution, of how we co-produce with people, also the understanding of how we design our documents to also be suitable for all who may have literacy problems themselves. That's interesting.
Okay, thank you. That was all the questions I had. Any other questions for either Rasheen or Vanessa? Okay, I'm going to flip back to my report because I skipped it on the agenda.
We didn't want to say anything, Chair.
I know, Rasheen. So thank you, Rasheen and Vanessa, for your report. So over to the Chair's report. Really, I'm not going to focus on going through it line by line, just kind of pull out some things really since the last report was produced for the board. Just wanted to pull out on governance matters. I think the key one there is that our Council of Governors met in public on the 11th of July, and amongst other important business that we discussed, the Council did approve in principle to progress with a significant transaction of the shared service model, and that's with an understanding that a formal request for approval from COG will be submitted with full diligence is completed, due diligence is completed, and the board has approved a significant transaction. So we look forward to that. You'll see there that I undertook a number of visits, I think, and every time that I visit one of the services, I'm really, really impressed by what I see, by the enthusiasm of the staff. Myself and Rasheen, we visited recovery near you, and it was great. And actually, we were sort of huddled into a room, it was like a boardroom, weren't we? Where, I can't remember the manager's name now, is it Angie? Yeah, where Angie, got her staff from, different sections of their integrated service that we provide there. And it was really impressive as well. And we're excited, obviously they're doing a lot of great work. And sometimes they can easily be forgotten because they're in Wolverhampton. So I would encourage anybody, if you get an opportunity, get a chance to go and pay them a visit, they would really welcome that, and actually be proud to highlight and show you and discuss the work that they're undertaking. And they're actually quite close to coming up to their contract for review. But and obviously they've got some a major competitor there, major actually doing and the engagement and how they're really connected on the ground was very palpable and I was really impressed by that visit, and I wanted to highlight that. I also went to let's see, I can liaison team at QE and also at Good Hope, quite stark, the two visits, but and also the team at Good Hope as well. But it was great to actually go out there, and they were really, I think they were really surprised at the fact that it was both Machine and I, rather than other Machine visiting them or myself visiting, but the fact that we both went and wanted to see and hear what's going on at the different services, so we can really bring that back and do whatever we possibly can to support them in the work that they're doing. And they're doing some great work under often quite challenging circumstances and environments that they're actually working in. So that was a couple of the highlights. Just want to see what else draw to your attention, and also visited VWC. So I went to Birmingham Women and Children's. And had an opportunity. I was taken around by Bruce, and also by Matt, and we just had an opportunity to talk about our partnership working, but also for me to actually visit and view the Children's Hospital in the city centre. So that was great to do, and I think those are the main key highlights I wanted to pull out from my report, but happy to accept any questions if there are any.
Yeah, I just wanted to follow up on your visits to liaison, because when I visited them last year, it's amazing the work they do, those sites, but particularly at UHB, there were challenges for them around, I suppose, the commissioning of their different bits of their service, and also the environment and their space, and whether we've been able to work around that aspect of it, that sort of working with that acute provider to improve those sort of commissioning arrangements, I suppose.
Yeah. Well, unfortunately, during our visit, the situation remains the same.
Yeah.
However, there is work going on. With the leadership and the QE in particular, the hospital, to make some changes to that. And I know that Phil will want to also take an active role in pushing.
It's having that experience personally in the children's for many years, and that challenge of providing liaison services in the hospital, it's around continually highlighting, isn't it, and flagging it up, but it's also that two-way arrangement. We're supporting them in other ways as an acute hospital, and how can they support us with some of our challenges. So it's a two-way process, isn't it?
And it's interesting because obviously there are separate cultures and ways of working in each hospital, despite being one organisation. So it is particularly around the QE that we need to, we need to really find a way of working in a much more integrated way. It's working very separately, and that isn't in the best interest of those teams, and therefore the patients, I think.
And it's getting that evidence, isn't it, and getting it on their agenda so that it's in their interest to work in that integrated way.
Yeah, it's a challenge. In the past, we've had good partnership working with UHB, particularly Vanessa and Jonathan when he was in his former role prior to becoming chief exec. And so we kind of want to re-establish the communication channels so that we can get the best for everybody. It helps, I guess, that I sit on the board as well. And so, that was my first opportunity to actually visit the liaison team and see where they are located, which isn't great. So, that feedback is not only for this board, feedback will go back to UHB's board as well, as I'm sure you can appreciate.
Yeah, thanks. So, not on that note, a separate one. So just your point around recovery, maybe sort of from a business development perspective, just to show you that we have already started to look at that, to make sure that we going through our usual processes of the tender process. So just to assure you that we have started doing that.
Excellent, because they do a fantastic job there, and I would hate to think that's another large competitor would secure that contract. I'm almost confident, given what we heard, that we would be able to demonstrate value for money, because it definitely does do that as an integrated service. Thank you. Any other questions for me? Okay. So if we move on then to the next agenda item, which is our board assurance framework, which is the
Yes, thank you very much, Chair. I take the paper as read, and I will just draw out the key points from the paper. This report presents the state of activities, the current position of activities within the bank as of the last review by board committees and the risk management group. The Healthy Energies Board argues that the most effective boards are those that use the board assurance framework as a dynamic tool for driving their conversations and for driving their agendas and discussions and decision making. Taking it in trust, taking it on trust, on the other hand, makes the case that the aim of the bank is to provide the board with appropriate confidence and assurance that the organization is providing high quality, safe care within a very safe environment, and that care is delivered by staff who are well trained. So the purpose of the bank is to provide assurance to the board. And then the other section highlights some of the conversations that have taken place at board committees. It starts off with the conversation that took place at the FPP, and it identifies the 3 risks that have been identified at the level of the FPP. It goes on to identify the 2 risks that have been identified at the People's Committee. Just for a quick correction there, where it says 24th of August, which is this first paragraph, is meant to refer to 24th of July, please. So yeah, we're not yet on the 24th, so sorry about that. So the People's Committee met and then identified 2 overarching risks, which have also been reflected there. And then QPS will be meeting later this afternoon with the executives who sit on QPS, and alongside with the non-executive directors, will be sitting with the ADs to identify some of the overarching boundaries that will emanate from the quality and the clinical service priorities, which will reflect on our new board assurance framework. The fundamental purpose of all of this is to make sure that by the time we will have the strategic board development in September, we will have the new look back, which will be presented there for wider discussion and adoption and for wider use across the organization and across the business. Some of the challenges that may emanate from some of this piece of work is the fact that we are dealing with annual leave at the moment. A lot of colleagues are doing annual leave, but again, we're just trying to see how we can pull together even deputies so that they can support us with having a more rounded perspective, a more rounded view of the assessment of the boundaries that are identified. So the board is being requested here in terms of the act to note the changes that have been made to the board assurance framework as of today, and also to endorse the trust part as well. And then the rest of the report sets out in more detail some of the changes that have been reflected on the board assurance framework, which will be approved at the risk management group on the 22nd of August. And then those changes will be embedded now in the bank. And then section, the table 1A sets out a summary format of the board assurance framework, and then the appendixes set out the board assurance framework from the various board committees. Thank you. Happy to take questions.
Just observation based on discussions in the FPP. it's important we have this discussion in September about all the development session to make sure we're up to date around this. So what we're saying effectively, we've got a path in place that still fit the campus, but we know there are a number of changes that we want to put through to it. But also, just to say, in terms of some of the risks, there's things like, for instance, where the inherent risk rating, i.e. if you do nothing, the risk rating is actually lower than the current risk. So we've got some situations where the logic would say that either we've got the inherent initial one wrong or the current wrong. There's also, I suppose, reflecting back in some cases, there's a feeling that we've overscored some of the risks. So we just need to make sure we've got that in, because there is a danger of either overplayed or underplayed and get that consistency. So we do need to make sure both when we have that discussion there, but also the risk management group, that we have that proper real alignment across.
I just wanted to ask, I mean, nothing's shifted in terms of there's no risks that have gone up. Most have either remained the same or some have actually been sort of downgraded a couple of points from probably from 16 to a 12 or from 12 to a 9. In relation to, and it may be on the corporate risk register, so please forgive me, but just wanted to clarify. Rasheen mentioned in her report the thanks that she gave to our IT colleagues in relation to responding to the national outage, but clearly cyber attacks are on the increase. How does that, or where does that feature in our risk?
Okay, I think it's about, is cyber a strategic, or is there a strategic objective that will describe that? I think that's the problem at the minute. So we need to have something that reflects that ability to continue business as usual, is the point. The corporate risk register and the IT project would have that in. And we do have a lot of work that goes into that area. So I think Sean's reflected that discussion with the FDP about the desktop reviews and all that sort of stuff. And what we've already here does indicate that. But there are a few where we haven't really got the right, mind you, the right strategic objectives to have a risk against. So it needs to be one that either we're being specific about cyber, or more likely it's part of an overall part, destruction of existing services. So for instance, the thing we described about unrest in the community, that would be an example of that type of thing. So we just got to be thoughtful when we go through about stages in the right way.
I mean, it may be that we can have this discussion in September, because there are risks that wouldn't feature as part of our strategic objectives, but we've got our strategic objectives on track. And so I really want that. So actually, they might not be, linkable specifically, but they would actually have, catastrophic or very significant impact for us. So I think there's something about having that debate when we have those strategic sessions in September.
Yeah.
Just as just a suggestion, it may already be in the plan to do this, but we can review the BAF risks, but it'd be good to have some visibility of the corporate risk register, just to have that sort of assurance around line of sight. Okay. Not to get into a debate about it, but just to make sure that we correct me
if I'm wrong, but the corporate risk register, or those that relate to different committees, go to those committees, so it comes up our committees.
Yeah.
I think, are we linking them as part of the back parts that we can say
Yes.
corporate risk one?
Yes.
So you go to the corporate risk register, what you see is those risks that's written there, showing alongside the back. So if you go into an individual one, you should see that linkage.
But just back to the digital risk around cyber attack and zero-day attack. On the back of the conversation at the board last meeting, the director of ICT came to the FPP with a report around that. The report was to provide assurance around our digital resilience and the infrastructure that we have in place. And he provided sufficient assurance there. And so the conversation was taken forward would be how to develop the boundaries around that, which leads up to what Dave has already said. So I just want to say that there's a lot of assurance provided. The last FEP meeting around some of the work that our ICT colleagues are doing in terms of troubleshooting and preventing as well. And then around the resilience that we have in terms of cyber network.
Thank you. I think it's a good program that she mentioned for us to have a great discussion about this at the strategy meeting in September. But I thought it was really important for me because it's not going away. As in, and this is it's a national threat rather than just a localized threat. And because it's a national threat, it's something that we, I know we're citing on it, but it's just kind of like where it actually sits in terms of risk and how we prioritise that as a trust ourselves. Yeah. Okay. Brilliant. Are there any other questions for David? Flip from David to David, who's going to do the
So, I suppose I'm trying to reflect in here the discussion we had at the board and the board done the session previously. So there's a little bit more detail on around things like the staffing, etc. going through. I'm happy to take any comments in terms of, is this fit for purpose? And we'll try to ask that same question. Are we doing this in the right way going through? We moved this earlier on the agenda, so rather than taking that to the committees, we took the view that we bring it in here first to work that through. Yeah. So just working the way through the report, a couple of things where we have been monitoring a number of things that were off track for a period of time. Two that we're flagging up there, both talking therapists and service users with a CPA review in the last 12 months, they both improved significantly over the last year. So the service users with the CPA review in the last 12 months will be removed from that list. That's actually sustainable there. Yeah. Also, we've heard several times about talking therapists. Certainly, I think it's the 6 weeks that we're achieving, the 18 weeks is still a little bit off. We have heard several times about the dependency in terms of staffing in the Birmingham health mines, etc., that cause some of that. We have got, and we have talked about the new metrics that have been introduced as part of the overall test planning that are all allowed for and included in the integrated performance report. In some cases, there is improvement we need to do against them, but we are monitoring, etc., reviewing through. We talked a little bit about anti-variant, but Vanessa might say a little bit more about that, so I won't labour that one. But going through the rest, I've included in terms of the staffing, the breakdown that shows it in the different areas, because there's this, and I mentioned at the board development session, looking at just the overall figure doesn't show the variation by different areas, and it's important to see that. So the overall position about staffing or people on post is improving, but we have got some fluctuations within the individual areas. And I think it's just important, I asked the question before, if that's actually picked up in that type of way at people committee, we just need to make sure we're putting both of those. So that's not for me to answer, it's just putting that up in there. We've also got some details from the deep dives we've done in the different areas. They are working really, really well. They're really useful to get into a level of detail and understand some of the restrictions, the barriers, etc. that's been identified previously when we talked about when non-execs or others have gone out to meetings. That would allow us to put that to a more systematic way. I wasn't particularly going to say more, but I can answer the question. But I don't know if you want to say more than you've already done. And that's very whether that's sufficient. I think it is right. We are going to see a worsening situation in July.
Yeah, we did in July. So we monitor, as you know, and I've described here before, and it's always described in the report, that we have an out-of-area steering group that meets every Friday at 12:30, be down B Square. Good representation there, and Vivida really helpfully provides that more of that senior clinical oversight working with colleagues, so that's really good, that this is not just about ops and management, this is about that clinical oversight as well, so we work absolutely, arm in arm around that. The areas of focus are around gatekeeping for home treatment, so again looking at that, what more do we probably need to put into those teams to actually make that metric 100%. At the moment we're sort of floating around 65-70. We know home treatments have a good threshold and a good understanding of how they can support people in the community as opposed to going into potentially a bed. And so that work is continuing. There may be some more investment in there, so we're working as a wider system around how we could potentially shift monies around to invest in that team a little bit more, particularly over winter, because we're talking about our winter planning now, albeit it's summer, we've all got our sandals on, but we are talking about winter. So what do we need to do now to actually think about winter? We have a 100-day UEC plan, acute and emergency care plan, where mental health is really integrated into that, so that's one of those things. Our locality working again, working in localities, working around beds with home treatments, community mental health teams, and looking at their local population and working together as a more integrated way, as opposed to a home treatment team here and inpatient there. So again, that's working well. I think we're seeing some good benefits over in the north, and specifically over in senior, which is more central around how that's working. So again, really putting a lot of effort into that, and some more clinical oversight around maybe some of the challenges around people who are really poorly in the community, who may need to come into a bed, but can we support them in a different way? So there's a lot of work going on around that. I also mentioned in the report around people who are clinically ready for discharge. So that is a real opportunity, and something that's, a lot of it is in our gift. But we do have some shortfalls with working with our local authority colleagues, as well as our housing colleagues. So actually, how can we do and work with that better? We do have mind workers that work with us as well, and are working with our discharge coordinators. But again, can they help and support in a different way to help that flow back into people going home or into their accommodation? So a real massive focus. We had a 4-week increase over July, so we managed monitor those figures week by week, where our psychiatric intensive care usage, our PQ as we call it, absolutely went up. But then we had people who were ready for discharge out of area who were in PQ, so we brought those people back, and then we had to move across. So that helped stabilise our PQ usage. This month, this week, we've noticed it's plateaued over the last couple of weeks. So that increase has gone, and now we've actually plateaued. We can see, and we monitor discharges coming back, and people stepping down from PQ out of area into acute. So we had a spike in acute. So we have data, loads of slides that, like I say, we monitor week on week. And the question we keep asking is, what more can we be doing? I know for BD, you spent some time in looking at bed management, and again, there's some things that's again sort of quick wins and support that we could do actually to help that even more. It is absolutely a top priority for us, and we're expecting, all the divisions, albeit that they don't sit in urgent care, have got a role in actually supporting this work as well, because there's lots more we can do to prevent people in the early intervention of people going into crisis in the first place. So I don't know if you wanted to add any more.
Yeah.
I know we work closely on this.
I think you've covered most of it, but we're planning to have a lot of meetings with the senior clinicians and ops colleagues to look at how we can really embed that locality model and make sure that people are admitted with senior clinical decision making as to what's the alternative, if that's appropriate. Can we look after them in the community rather than send them hundreds of miles away? So we've spoken to many of the clinical leads or consultants, and they're more than happy to come together, support. We've got a workshop in late September with Ian Davidson from NHS England, so we want to do some of the work before that to get the teams. But a lot of that, as Vanessa said, is about early help, the CMHT, the neighbourhood teams, the primary care. Our GP colleagues are also in conversations. So it's really sort of like we're under a lot of pressure and trying to do things at the same time. So it's the same people who've got to be in all these conversations, and that's a challenge for us now. So we do need some extra capacity, especially in our home treatment teams, and some of that has to be out of hours. So that's the conversations we're having.
Thank you.
Yes, I just want to touch on the point that Dave made around the people community specifically. So given that we have a specific goal within the people community around resident nurses, that's the area we've had the biggest concern. Our report is the detail around band 5 nurses specifically, breaking that down, whether they're homegrown, internationally educated, and also whether we're meeting the trajectory that we've set for the year. We don't have a breakdown by division, but we also report the overall. So we might look at that with Sue as the chair, we need to kind of bring that breakdown by division, but essentially the reporting has been focused more on the goals that we've set around the trajectories and what we report.
Just say actually the workforce dashboard does allow you to cut it by both.
Yeah.
So you get a reporting, so you can see it broken out by both service area at the same time as the qualified staff in that area.
Yeah, I mean, it's the difference between being more intentional in reporting and the expectation of people to drill down into the dashboard. So I guess that's the conversation we just need to have. But in terms of the goals and the trajectories that we've set, that's reported through the committee on a monthly basis.
Any other questions? I've just got one, really. When you look at the IPR and you review it either from the previous 6 months, then you take it back to the previous 12 months, and you then take it back again to the previous 2 years, it's the same areas where the dial isn't shifting that much. So, some examples, we know out there, we know that, but say for appraisals. So there's some key ones in here, and I'm reading and thinking, I could actually pick up an IPR of 2 years ago, and these same areas would be the areas where we don't appear to be making as much traction as we would like. How are the committees actually reviewing that? Because obviously this goes to the committees, and then obviously it's down to the specific areas that said can be considered, for example, people committee and appraisals and fitness rates and so forth, and looking at the policy committee in terms of care planning, etc. And just pulling these out as examples when we've got the out of area. And the out of areas may be that we've got external pressures which also cause that, but it has a significant impact on us achieving our financial targets as well, because obviously actually, if it continues, it's going to really significantly knock us off track. So I just wanted to bring that out.
Yeah, I'm happy to start, Aston. So in terms of the people committee, as you're aware, we have a series of deep dives, and that's for us to focus on some of the wicked issues that we have as a committee. So for example, we had a deep dive previously around workforce transformation, and that was there really for us to focus on where are some of our hotspots and what we need to be doing moving forward. And we have another deep dive coming up around safer staffing and e-rostering. So that's an opportunity really as a committee to really go into the detail and understand how we can all collectively work together. So I think in terms of the other areas that you've mentioned around appraisal, although we've had robust conversations in the committee, yes, there will be subject to deep dives in the future on what else we need to be doing. I think we have been making improvements in some of those areas. I'm sure the paper that's presented will demonstrate that.
Mm-hmm. We did have a discussion around the appraisal uptake in our committee meeting. I think it was Bal that raised, an observation that outside of public sector services, if you don't do your appraisal, you don't get paid. And it's interesting that there are some constraints around the paperwork and the systems that we're using to upload appraisals in the organisation. Not everyone has access to the system, and the system has been fed back that it's not always user friendly, but that's a system that the NHS as a whole is working with. Because when we look at the medical side with our clinical doctors, the appraisal response is very high, it's 98%. But that's not across the organisation. So as Patrick said, it is something that we need to look at a little bit more deeply and see what we can do to change.
Thank you for that.
Yeah, I mean, at FPP, we have regular, quite robust discussions around some of the metrics that we really need to be shifting. I guess the key, if you use the outer areas, there are things that are within our control and things that aren't within our control. And I think, the focus needs to shift perhaps in terms of those areas that aren't within our control, but we can maybe try and influence and sort of look towards collaborating closer. I'm not saying we're not already, but with some of our system partners and how that whole flow of patients work within that scenario. And then that sort of aligns to what we do strategically in terms of our objectives and moving forward. But of course, if you put out areas to one side, you've got NHS-driven metrics that then become a focus that aren't necessarily fully aligned to where we want to go strategically. So there is that sort of gap as well. But I think, as we go into the strategy refresh, I think all of these things need to be sort of all in mind, and then how we bring that together, I think, will be the trick.
Thank you. And Thomas?
Thanks a lot. I just wanted to pick up on the point around pressures for acute wards, crisis teams, and also the liaison. We've discussed those in a variety of mechanisms this morning. With the new staff that are coming in, which are largely acute, is there an opportunity to build cohesion between the number of liaison teams, crisis teams?
The trust rooms, by the way. Sorry about that. Sorry.
Yeah, that's you got the first half of the question. So, yeah, absolutely fine. So just in relation to mental health liaison and crisis teams, more closely aligned in terms of thresholds there. Often they get better protection you get for and the robust the admission avoidance mechanism. So I'm just wondering with the new staff, can we develop that along in terms of opportunity for them to be familiar with those thresholds, but also perhaps think about how we measure that performance-wise, because I'm conscious with crisis teams, one of the core metrics we don't show is how successful they are in admission avoidance as a metric. So there's loads of things there that we can do to increase the quality and opportunities, but I'm asking them
I suppose there's two options there. One, I think the point that Vanessa was making around that whole kind of locality team working, so actually that opportunity is saying it isn't just a home treatment team issue, it's a management issue, it's how people work together. We've certainly started to look at how, particularly thinking about internationally educated nurses, where we're predominantly bringing them into inpatient settings, but thinking about more rotational roles that give them that exposure and perhaps give that side of things as well. And what we do track is, so we know, for example, how many people are being intensively supported in the community by our home treatment crisis teams on any day. And we also know that many of those traditionally would have been seen as waiting for a bed, but actually the reality is the majority of those are managed well and then they step back down again. So we do have information that we can align to that way of thinking.
Quickly, as part of our metrics, so I'm a member of our BSOL UEC board, so Urgent and Emergency Board. And we are looking at mental health metrics. So we have our metrics, which is around how quickly someone's seen the ED departments by our liaison services. So our metric and our KPIs within the hour. So a lot of our teams, apart from QE, is quite close to sort of 100% of that. So that's good. And we've also been asked about doing some work around home treatment team caseloads, and again having that as a metric, again to show those. Picking up with people really quickly and that admission avoidance. So we've been working on that with Faith Button, who's my counterpart over in the ICB, as well as Ian over at UHB as well. So getting absolutely those metrics will actually show that. So it's working train. So yeah, definitely.
Thank you. Thank you. Just, I thought it was important just to bring out how we are utilising the IPR, how we're actually focusing on sort of those key wicked issues, as Patrick mentioned, particularly within the committees, to see how we can make improvements. And Val's point is right. You know, obviously some things are outside of our jurisdiction to change in terms of there are other mitigating factors that contribute to why we're off track on performance in particular areas such as out-of-area placements. But there are other things that is potentially within our gift to actually see where we can make a difference and make improvements. So I think as well, it's I feel better that the IPR report is positioned where it is, as you mentioned, Dave, in the agenda, because it's the main focus of it goes better. Okay, thank you. Thanks, Dave. So moving on to you guys' qualification experience and safety assurance report.
Thank you, Chair. We've had two fairs since the last board. First one on the 19th of June, second one on the 24th of July. And you'll have had the AAA report to read, but I will just highlight a few key areas from both reports. So coming to the June reports, in terms of alerting the board, we wanted the board to be aware of the change in approach from the CQC as regulators, with a focus on effectiveness and responsiveness also being monitored by them. We were alerted to vacancy issues in our IPC team and risks in relation to that, but vacancies had been recruited to, and we anticipated that would be less of an issue for us by July. We wanted to assure around a number of items, but one that I'll highlight is the improved metrics for complaints has been significant, and that is interesting, Phil, what you were saying about the sort of ongoing concerns that have been noted by the committee for some time, and actually it's been really positive to see how in the last month or two there's been a significant shift in that, and actually that's a really important part for us in terms of monitoring the quality of our services. Moving on to the July reports, again highlighting from what I know you've already had a chance to look at. In terms of alert, following an inquest into a service user that absconded from an inpatient ward last year, a prevention of future deaths has been issued to the trust by the coroner, as there was a concern that when a high-risk mental health service user is missing, it requires effective and meaningful multi-agency coordination, and the evidence at the inquest highlighted gaps in knowledge, coordination and application of policy. Another alert was the Right Care, Right Person data set is in use on current activities, and there's a live risk register. The remaining risk identified is in relation to agreeing processes and response in managing Section 136s and having a shared understanding between ourselves and the other organisations. But on a positive note, our working relationships are continuing to be developed and strengthened to share that, to strengthen that understanding, and will continue, we anticipate, to lead to improvements in that. Wish to alert the board to a suspected serious incident in relation to a sexual safety incident, and there continues to be a focus on professional standards and boundaries in line with the trust policy on this. In terms of assurance, as was mentioned earlier from other reports, the CQC visits feedback has been positive, with teams being recognised for their hard work and dedication in providing the best possible services. And service user feedback to CQC has been positive with notable improvements in care planning. There's also been notable improvements with the CQC responsiveness, with positive working relationships being developed as the trust moves towards the removal of our section 29As that have been in place for some time, as you know. Another positive assurance is around a new weekly trust safety huddle for initial review of incidents, safeguarding alerts, any regulator escalations and complaints, and that will be incorporated into our patient safety and incident response framework. We have undertaken our committee self-assessment review, and it was a positive review with overall effectiveness of the committee being seen as positive. In terms of advice, we received the Freedom to Speak Up Guiding Report and committee approved the recommendations for senior leaders and divisional leads to continue to promote the use of champions in their divisions and their areas. And we endorsed the report to the board of directors. We've already talked about the board assurance framework, and we were able to conduct a deep dive into our risks linked to our committee. And we're able to, I have been thinking about this for some time as well, but we're able to take the time to review, and it led to an overall reduction in 4 of the BAF risks. So the one involved in linked to prevention of harm, the one linked to our being rooted in communities, the one linked to our early intervention and prevention approaches, and the other one in terms of us being a leader in our system. And we are due, as David pointed out, to have our discussion this afternoon in relation to how we might streamline our back risks, because we have quite a high number at the moment. Just another advice is just the clinical governance committee meetings are being reframed to allow a more focused review in divisions, and the sort of agendas and forward plans are being reviewed and revised. I just wanted to advise the board about there being a continued focus on psychological harm to staff, and that there are now mechanisms in place to escalate and formally report these incidents, and we are getting an increase noted in that reporting, which is positive. So I think that's all I wanted to highlight from you guys.
Thank you.
Any questions?
Are there any questions for Linda? Just one for me. You haven't reported on it, so I'm just asking, is the committee still focused on PCRAF?
Yes.
Yeah, so and I'll perhaps talk about 2 things. So one of the things that we're doing at the moment is strengthening our patient experience group. So at the moment that reports through Clinical Governance Committee, and it hasn't previously been chaired by the chief nurse, but certainly we should have had a conversation about how we move forward as co-chairs now, and that starts to report directly into QPET rather than through a filter. I think in terms of PCRAF, some of the data that we use and how we understand that reflection of our communities, we're starting to see much more demographic data coming through our reporting, which is good to see, because that's always been quite a significant barrier. So that we're now seeing. What we want to do next is think about, well, and what do we then do in response to what we're learning from that? You know, how are we actually tailoring our actions? And there's a lot of activity and work going on within the teams that isn't then coming through into some documentation that we see. So one of the easy conversations we had around quality and safety was that there are a number of actions that weren't yet reflected in the back that we're taking to reduce risk, but because we haven't articulated those yet, people are really just busy doing them rather than talking about them. We've not yet got that evidence to come through. We had Jazz do a really good presentation at the Clinical Quality Group, and we've committed for Phaedra and I have committed to meeting with her and enabling her to bring some regular reporting through as well, because it will give us an additional lens in terms of the richness of information that her and her team get, not just around our impact on communities, but all of the work around health and communities as well. So we do need to link that through. So PSERP, PCRES, and our, what I would say, a simple linear route from our service users and patients and communities through then into the board. And at the moment, and colleagues will recognise this, we've got a slightly clunky sub-QPESC collection of groups that we probably just want to consolidate and simplify for people. And I think there's quite a welcome for that. So we've got a workshop for corporate staff, some corporate governance team, and for our service and divisional leaders at the beginning of September, because we want to really co-produce that. And we also want to bring in the lens of the Manchester reflective work that Oliver Shanley led with the Scientists Committee, who's talking to Cat at that committee of board development to work around that. The other thing I just wanted to add, because we have had a number of preventing future deaths reports, I think that one of the key themes that comes through is about communication and handover. And what we're seeing is that risk at that point of a transfer of care, be that from an informal patient in the context of being taken then to a place that's been identified as good safe care for them, or be it a communication between our staff and other public sector partners such as the police or the ambulance service, where we're not effectively communicating between us that level of risk that the patient poses. I think that's the area that I really want us to focus on. I think for me that's where we've sort of come through to, is that bit about how much pressure there is, particularly in the urgent care system, how much pressure our staff are under, that sometimes that constrains the amount of time then taken to really sort of pay attention to that level of risk at a handover period. We know in NHS handovers are particular points of risk. So I think more reflection for us thinking, and then what we do to support our clinicians with the simplest of ways they can understand and do that is a focus for.
Just to add that the weekly safety hut has already started making an impact in terms of very quick planning and working together. But also with the health inequalities board will now report to QPES. So as a summary of everything in the trust, including PCREF, that's going to come through QPES as well, because we want to have the quality aspect across discussed.
Excellent, great, thank you. Thank you both. Thanks for that. Appreciate that. So we're going to move on so we can turn to the committee report, which is
Thank you, Chair. I'll keep it brief so we can catch back up next time. In terms of the committee, people committee meeting and AAA assurance for the board. So for alerts, we'd like to advise the board that the Trust was reporting above trajectory for fundamental training compliance, and it's still below the key performance indicators, so there's still some work to do in that area, and we are sort of looking at sort of working with those individual groups around meeting those fundamental training compliance. There has been a slight reduction in the uptake of the first line management training programme, but there's also support in place to ensure that all managers complete the programme. And I'm sure Patrick can give us an update on the timelines for that to happen. There's been a steady increase in the appraisal completion, but it is still below target, and we are sort of putting in place targeted support to provide support in those areas of concern. For assurance, also on appraisals, the committee was assured of the high rate of compliance with doctors in the appraisal and revalidation process and the robust job planning arrangements that have been in place. The committee was also assured that there was an increase in the recruitment of international student colleagues, And there's also been an increase in the uptake of apprenticeships across the organisation, so it's good to see that we're starting to really utilise that apprenticeship levy spend across the trust. The significant reduction in bank and agency staff was also assured with further work plans in place, and also we've had a positive workforce race equality standard and WOODES, the Workforce Disability Equality Standard report, which was received and will be presented later in the board. Advise the committee, again, as mentioned with QPES, received the report on the governance arrangement for the Freedom to Speak Up Guardian, and that was received by the committee, and we were also assured that the framework had also been shared across the West Midlands. Freedom to Speak Up Guardian Office and was approved in those areas as well. The committee was also advised that there's ongoing work to support the efficiency of the employee relation process, and also there's work underway to support the sustainability and retention of staff through the development of a grower, which also includes the state interviews with our work colleagues that are considering leaving the organisation. The board assurance framework, the committee identified that the following revised risk of our two areas for the new BAF were drafted and presented to the committee for review. We'll also look at further refined version of this in August committee meeting, along with a summary of the refresh BAF for September. And that brings us to the end of any questions.
Excellent. Are there any questions?
Yeah, so thanks, Luke. So just to add to what Sue is saying, just additional context. So first of all, around fundamental training, what we reported to the committee is that we currently at 94%, and the target is 95%. So it's just to give context that we're not far off the target, and also to say we have surpassed the commission target. So this is our organisational stretch target that we haven't yet met. So I just wanted to give that context to the board. In terms of first line management, we expect that by the next quarter we should be able to catch up in terms of that slight decline.
Great, that's good to hear. Thank you. Any other questions? No? Okay. So if we move on then to the Guardian of Safe Working, you need to present that.
Yes. Hi everyone. I'm new to the position, so Dr. Pantel's left the trust, so I've just come into post. So this is Cheyenne's final report. So the summary is there have been no immediate safety concerns were raised during this quarter. Exception reporting remains low, with only 6 unique exception reports raised during the quarter, 83% relating to overtime working. 50% of exception reports raised during Q1 were in a single department, so this was the psychiatric liaison department in the Queen Elizabeth Hospital. A further 12 exception reports have since been raised by another doctor working in this department for dates in Q1. They weren't able to submit in time, so because of issues with getting access to the system, so they've only been able to submit during Q2 for those reports. 9 out of the 12 of these reports were related to overtime working and not being able to take natural breaks. These issues have been brought to the attention of the clinical director for urgent care and the deputy medical director, and the workload for postgraduate doctors in training is now under review. No fines were levied against the trust for breaches in safe working hours, The first quarter that this has happened since Q3 of 2022 to 23. 3 exceptional reports raised during this quarter were closed during 48 hours, representing a significant improvement in prompt review and closure. The number of outstanding reports carried forward has remained stable at 12. The number of vacant shifts continues to be high but stable, with gaps particularly prevalent on the ST North and East rota. The majority of gaps were due to post vacancies, and this is 52% of the gaps. All on-call locum vacancies were filled during this period, and the final point was that by
And welcome. Are there any questions, any queries on that?
Just to say thank you to Hari for taking over from Shreya, and there's been a very good handover and you know, the meetings with the director.
Well, welcome, Harry, and thanks for coming along and presenting Shreya's report. It doesn't appear as if anybody's got any questions, but it's interesting to see, again, you know, about zoning on that area, which is the Queen Elizabeth Hospital, private section of goods. Again, this was related to overtime, assuming this is in E&D, this is, yeah. To support our colleagues. But I don't have any further questions. So again, thanks for coming along today.
Thank you, everyone.
Thank you.
Okay, this brings us at a very good point. So have a quick comfort break, and then we'll bring Jazz in 5 minutes. Yeah.
Mike says he's got a box of stuff for you. That's what he was calling, yeah. Yes.
I just need to do the virus assessment,
I'm just going to grab a quick drink.
Preston, it's not very well, so,
It looks like it's on the next floor, if we give you a stone.
oh, too many things happening at the same time.
Sorry?
Too many things happening at the same time, sorry.
Okay, can we continue? No, you're okay. Oh, right, chicken, that's it, I'm back to the chicken table. So that might check what it comes on.
Thank you. It's a bit strange, isn't it?
Well, if you do it on top, yes.
Wheelchair? No, in fact, sorry. I've got this huge implant. All of it.
Yeah, quite intense. Like when you come out yesterday.
Yes.
We are going to read our corporate approach. So welcome back everybody, and those of you online, we are reconvening and we're going over to our next agenda item, which is the workplace rate equality standard and the workforce disability equality standard report presented by Jess.
Thank you, Chair. I'll take the report as read and just highlight key points and key developments. So as we know, in terms of our updates in relation to the workforce race equality standard and the workforce disability standard, there are numerous intersects, and they clearly are highlighted in relation to the progress around the work streams and the key areas of developments essentially that I do want to take some time to highlight. One is the dedicated directorate support from our equality, diversity, inclusion business partners and our organisational development business partners. That's very much with the intention of bringing together all equalities related matters into our mainstream approach to values, behaviours and culture. And that's been very well adopted and very well utilised across the divisions. There is also, just recently we had a critical friends session whereby we engaged local community service users and carers to really look at our health inequalities plans, which does directly link to our workforce race equality standard and our disability equality standard in relation to building that trusting relationship with communities. And that isn't detailed in the report, but it's something quite recent that I just wanted to kind of bring to the table. We are also really excited about the fact that we're in phase 2 of rolling out our anti-racist behavioural framework, which directly relates to our approach to anti-racism, anti-discrimination, and also supports some quite explicit highlighting of behaviours we want to see in our organisation and also behaviours that we don't. And also we're really happy to celebrate the fact that we're working in partnership with Birmingham City Council around being a pilot trust for their cultural competence and cultural humility training. And the biggest news and the most recent news in terms of our launch in our phase 3 of our No Hate Zone is around our disability pledge, of where we've had significant uptake to date, and we would encourage all board members, if they haven't already done so, a majority have already got them, yeah, brilliant, it's just a bit of a shameless plug, so apologies for that, is to please come to the programme, but also encourage a conversation. So the badge is a conversation starter, it's very much to assert our identity in relation to either being allies or really advocating anti-discrimination across all of our protected characteristics, but definitely having that conversation about disabilities, visible, non-visible, and also those that we've lost in the experiences, which is really important to note, and is also highlighted by one of the colour streams in your badge. So that's just a bit of a brief update in terms of the key points that I wanted to highlight. In relation to the data, there are some things that are showing some really promising, I want to describe them as green shoots and elements that we need to keep flowering and nurturing, but there are also some significant steps back that we have taken. So just really to emphasise, particularly within our disability update, the increase of disproportionality in relation to our capability process. So colleagues are over 4 or 5 times now more likely to be managed under our capability process, which is a significant disparity, and one of the most important ones in terms of progress or not that I wanted to highlight within that area. So the team are currently looking at what does a response to that look like, and how do we support colleagues across the organisation in effectively understanding the disability experience, particularly around reasonable adjustments and also pastoral conversations within the workplace. So that's something that the team are actively looking at now. And in relation to the workforce race equality standard updates, I just wanted to take the time to highlight that we are increasing in terms of being global majority status city across Birmingham, and our workforce has shown a small increase in relation to our representation of global majority representation. We are also improving in terms of our experience around career progression or how our colleagues feel. They are supported to develop their careers across the organisation. And also there is a reduction in terms of colleagues experiencing discrimination at work from other colleagues. So we are on that kind of positive trend. As a disparity, as a kind of a negative kind of experience is around the recruitment processes, whereby we are currently 1.8 times more likely compared to our white colleagues in terms of recruitment to shortlisting. So happy to take any questions or points of clarity, but really appreciate the fact of the paper committee colleagues taking the time to read it, digest it, and also give it the importance that it requires to make the traction that we need as an organisation, especially given the climate that we're in now and today. So thank you.
Thank you, James. Are there any questions?
Question was just more of a comment really in terms of, I'm just interested in your point about, you know, some green shoots, but there's still a huge way to go. I think what we want to get underneath is what's helping, what are the things that we are doing intentionally that we think are making the difference versus the things that we need to do more, you know, what else do we need to do?
So the things that we're doing intentionally are the local ownership, because there is a significant corporate support offer which does, as it says, support and help. But actually those changes and those systemic improvements need to be made locally and embedded locally. So equipping colleagues with the information, also the insight, and where the disproportionality occurs. What we could do better is collectively take ownership. There is still a narrative within the organisation that you will only get a job if you're white, whereas our data shows that actually it is worse now than it has been for some time for Black and Asian colleagues. So actually holding that data true and being really representative as a leadership group and as an organisation, that this is what our data is actually telling us. So how do we work collectively to ensure that there is parity? And also what we could potentially do better is highlight that, as we've seen locally over the last couple of weeks, it doesn't take much to take us back and further back than we have been in some time. So it needs that continuous change, but also a holding of incentives, initiatives and programmes of work that are working. So in terms of things that are to come, it's us being louder about our approaches to positive action as an organisation, being more intentioned to that approach and really thinking about what this means for us as a global majority employer within this city and across Birmingham and
Can I just ask a question as well? It's about the board representation. And I can see that, you know, we've still though got this unknown. And is that because we've got individuals that aren't declaring?
Yes, so on my last check of the data, which was after this report was submitted, is that we have full declaration rates now.
Okay.
On the submission time of this data, albeit for trying, for whatever reason, that wasn't complete at that point in time. So right now, the data is fully complete. But what I would say is, in terms of good practice, check on your data on an annual basis, maybe put a prompt in your diaries, so that we can really model that in terms of making sure that our data is live, it's correct, and we own it, because individually it's yours.
And I did support our board colleagues to ensure that they had done that.
Thank you, Chair.
Due date. Apologies, Chair.
No, I think it just showcases though how valuable it is, but also how it can drop by the wayside. So if it's happening for us, it's happening for colleagues out there in our organisation. So the task of that, although it only takes a couple of minutes, it can prove a bit of a pebble in our traffic at points in time.
Yes. You have your hand up? No?
Rishi is the question.
Rishi, so Lisa then David.
Thanks, Jazz. It's really good to reflect again on our data and what progress we're making and what not. I'm really interested in progression, particularly progression for professional and sports staff, given that we've got lots of opportunities in the trust. But there's still in some parts a narrative of, and I know we look at shortlisting conversion rates into appointment, but there's a lot of people not even putting themselves forward to the point of making an application or having a conversation about career progression, because they think that maybe, you know, that they won't have the opportunity, or there's a rumour that somebody else might have already been identified as really appropriate for that post for whatever reason. And I just wondered what else we could think about doing around encouraging that more openness around understanding what opportunities are available for people, that isn't just a sort of a fairly linear, here's a job here's one job that's available, you may or not want to go for it, you may or may not get it, but how do we kind of open up sort of routes of progression a bit more, do you think?
So, some colleagues will remember that we shared an approach labelled Flourish some time ago, and due to operational reasons that took a bit longer than we wanted it to take in terms of coming off the ground. So we now have a project plan around that. So over the next 12 months you will see exactly that, Lisa, in terms of all of that detail coming through, particularly around how do we have that localised conversation whereby we're identifying colleagues there are some niggles or there are some challenges in terms of clarity and transparency around recruitment processes. We've also buffed up our inclusive recruitment to now include a reporting mechanism of where equity panel members have been engaged, what their feedback is and whether structures are being followed or not. All of that layered with the business partnering model and the visibility of colleagues on the ground to have a different conversation. We're hoping will satisfy exactly that need. A central point where colleagues can access job opportunities and career development opportunities, but also an opportunity to have a supportive conversation with that positive action lens, addressing the disparities that we've got quite clearly highlighted. And that, just for reference, that was monitored through the Transforming Culture and Staff Experience Programme.
Thank you, Dan. Yeah, I'm just struck by the words in the position on the stability side. And I'm just conscious that includes staff and lived experience as well. And I think you just need to think about where I'd like to understand what could we do, what should we do, to try and do things in addition to. I know you've put a range of things in here. There is what could we do in that space to improve? I understand the campaign and all that type of stuff, but what else?
So Dave, that's one thing that really does keep me awake at night in terms of the growing disparities to that. So we have engaged with colleagues across the organisation, not just representatives of the network, but wider still in terms of colleagues going through the capability process also. Some of the things that they've highlighted is a central support point in terms of reasonable adjustments. Additional things that they've highlighted are a dedicated resource that they can have a supportive offline conversation, someone outside their management, whereby actually they can explore options as to what's available. It might not be a reasonable adjustment, it might be something else. So that resource is something that keeps coming up time and time again. So we're just looking at ways of how we can make that happen essentially. And then additionally to that is pace. So access to work have currently got a backlog, and the supportive measures take some time to come through. So what is it that we can do as an organisation in the interim or the here and now to make sure that colleagues are getting the best experience? And then in terms of the capability process in particular, there is something about all of the stakeholders that are involved in those capability processes. How are they better informed? And where, kind of, whether you call it upstream or downstream, the earliest intervention, do we have a supportive conversation that is informed through that disability awareness lens, rather than letting it get to a capability process and then we're dealing with the process.
It's quite stark, isn't it? 5 times.
Yeah.
And in this day and age that we are not an employer that is actually considered what can we do for for our colleagues that identified as having a disability, are they then taken through a capability process? I was kind of really reading the report, couldn't quite grasp and understand what it is and why is this actually happening 5 times more, not even 2 times more, what's that even, that stuff in itself 5 times more is actually sending a very clear message to us as an organisation that clearly we need to do more, and maybe there needs to be further retraining with our managers around this particular whole agenda. I believe. There's a few hands in the cases as well. So.
Yeah, thanks. So and just to add to what Jazz is saying, there's a number of different things we talked about, first line management, certainly that will be picked up within that team of training managers around understanding some of the HR processes. We do see that people tend to go down the HR process rather than really focusing on intervention. We've also really strengthened our mediation support as well, and also the process around restorative just culture, which is really important, really to stop people getting into an HR process and avoiding the conversation. So absolutely, there's a lot more work that we need to do around that. But I'll come back with separate points, but I'm sure others want to contribute to that.
I'm probably going to pick up in completely different subject lines, so if that's okay.
Yeah, we all then do that.
Well, I was just thinking that what we would ordinarily do in other circumstances where we see this kind of outline is we would think about where does the escalation happen and how do we ensure that actions aren't taken without appropriate escalation. So I'm just wondering whether or not that's something we ought to be thinking about in terms of getting much more information and having an escalation point around people who have a disability, who identify as having a disability, benefit capability, being something that is escalated, so we can have that over time.
Yeah, that's fine. We'll take that as a motion.
There was, sorry, Chair, just one second, you just reminded me, sorry, I should have mentioned it. There is also something around a similar model to the inclusion advisor being used as part of that conversation that's being explored. So we're just gaining good practice from different organisations to see whether an intervention like that could actually reduce. So taking the good practice from other interventions that we've had. So that is also being scoped out.
She was on the same point.
Yeah, similar to, well, just following on from what Patrick was saying, a lot of what Patrick was saying links into some of the discussions we were having about appraisals at People Committee, that actually that is the first point of call to identify where there might be training needs for individuals, where perhaps some of these capability issues may not be escalated through the process because managers have got the right training, getting the right culture to understand what the issues are, to kind of reduce that statistic, because I said 5 times, it's not really, it's really not acceptable. And I know there are issues with getting our appraisals to the point where we need them to be, but they really are the main focus in trying to address, I feel, some of these issues that we are experiencing.
Yeah. So how can we support you? How can we support you? You know, you've got a different point on this.
Yeah, thanks. As I'm just conscious, I know this is about res and WDs, but some other protective characteristics in terms of function are equally discriminated against. So, pregnancy and also age. I'm just conscious of some of the gaps we've got. And as the workforce starts to look at, I suppose, more flexible arrangements as they get older as well, I didn't see that coming to the board in any data that we offer around those 2 aspects. Is that something we want to see more of?
So we do age gap, pay gap, the age pay gap in terms of as many protected characteristics as we can capture under that. What we find with pregnancy and maternity is the difficulty in capturing the data, and also where there's a cause and effect relationship. So that's the premise on why we haven't currently been presenting anything to board or through our People Committee. And we don't currently highlight any It's simply recording pregnancy maternity is when someone has a period of time or there's a self-declaration. But we can explore what that might look like in terms of a conversation through transforming our culture. And if that is something that would benefit in terms of exploration.
Recognise that we're in much smaller numbers, but the important idea that we're trying to see is about the protection of purpose and equality. It's something that we probably should be looking at.
I can follow that up through an exploration exercise. Just to kind of confirm as well, the age characteristic is definitely captured through that age gap. And we are seeing disparities there, so that is something that we've got work streams along towards.
The reason I'm making a point is just the numbers are getting into my head, I suppose, slightly, in that we're getting fairly exercised with the idea of this stat, which we absolutely should, about within kind of disability being fractionally more likely. From the stats I'm aware of from Matthew Cripps nationally, he suggests that pregnant women are 12 times less likely to be employed by organisations.
So can I make a suggestion, which is that actually the committee explore the value of thinking about the other characteristics and the other cut of the data. That's probably the place for it to have that, be able to have that wider debate and discussion.
It's a second point. Yeah, thank you. So you'll note that in the report it talks about achieving 40% of staff above 8 and above being representative. Just because we've got added new board members who might not be aware of where that came from, we wanted to be representative of the communities that we serve, hence the 40%. However, we say that we'll achieve that by 2028. So, because it's not explicit in the report, I just wanted to highlight that. Because we recognise that we need to create a pipeline based on Lisa's question about how we support regions and progression. We need to create a pipeline to be able to achieve the 40%, hence why it's a stretch target that we set for ourselves, but over a long period of time.
Jazz, I mean, I think one thing that we can take away from the report is we can see some progress, albeit green shoots, and also the journey seems quite long, quite far ahead. But at least we're not receiving a report where nothing should be done, it's not shifting. It is, and we also need, I think it's about conversion rate, to convert that to our colleagues to say, actually, hopefully you will be feeling and seeing the difference, and so that some of these targets will significantly improve. But we're on the right trajectory, that's for sure. Thank you. Thank you as always. Thank you, Jess. So we're over to staff day. No, we're into our, and then
do a Freudian slip like a chair. Thank you. I'll take the reports as read. We've had 2 FPP meetings since the last board on the 20th of June and then likely on the 24th of July. Like I say, I'll take the reports as read, but just to summarise, we remain on track for our year-end forecast for the 2 year surplus. Challenges and risks lie around landing our cost savings around SIP, particularly in terms of how we deliver those cost savings in a recurrent way. Currently our plan suggests that we've got about 65% of those savings are going to be delivered recurrent. The other 35% clearly will then cause potential issues further downstream into next year in terms of how that sort of flows into challenges into next year and beyond. So I think the way you need to look at that perhaps just needs to be challenged. The good news there is that we're starting our process around investigating opportunities for next year now. sort of September time. So we're starting much earlier than perhaps in previous cycles. Out of area, I think we've discussed, remains a significant issue for the Trust. We did have a deep dive in June at the FPP. The committee were assured around the actions that have been taken clearly within our control. But I think, you know, that sort of broader perspective, we just need to explore a little bit more and just keep doing what we're doing, really. On assurance, we were assured around the work that the Trust is doing around bank and agency. I think we've made some really significant inroads into that and the cost benefits that we're seeing. On cyber, we've touched on this. I think Rasheen touched on in the CEO's report around the fact that we weren't impacted by the recent CrowdStrike attack, which was a positive. But again, nothing to get overly confident because there'll be probably more of these types of threats hitting Trust and other organisations across the UK and globe. We had assurance around the reprioritisation of capital. I think we talked about that, and they were going into that in more detail. We had a committee self-assessment, which was really positive. A few things that we recognise that we need to focus on change, but by and large, the feedback was highly positive. And again, the high profit business case, which is going to be discussed on the agenda today, was endorsed by FPP. Happy to take questions.
Any questions from Bell?
Thanks, Bell. So we're going to so on financial, just reflecting exactly what Val said, the report is my fault. The report should reflect a request to approve the repurposing described as a reprofiling the capital programme and approve the two business cases. So there are two. There's both the Highcroft one, which we've been talking about, but there's also the first base that Vanessa mentioned earlier on. So in terms of the other ones that do need approval, they will be in the delegation level of FPP to sign off next time for those others, because there were a number of new ones, including the first one was brought here because it's above the FPP delegation, so it's seeing that going through. So to talk about the overall position first, we are doing well against the overall plan we've got. What Val said about the CIP is true. It's also true that we're doing better than around in previous years, which is good. We've also got, I suppose the right word is, the difficulty across the town patch of the particular pressure on UHB and on their position. And inevitably that's an impact on the overall B-side system. And because the focus is always nationally about the system of individual organisations, there will be some implications of that, and there will be further discussion around it. So I don't know if that means, for instance, we will be asked to reprove our position on the sort of plan. I don't think there's been any discussion of that I'm aware of at this point in time. But it is potentially something we might look to do. I think we've already talked about significant improvement in agency, particularly in the docks, and that's happened over a long period of time. We'll see the benefits of that. Bank is also improving. The key risk really is the outer area. The unachieved CIP is in line with the additional CIP we were asked to take as part of the overall system. But the outer area is one where we have got pressures, and it is likely to get worse in July. Yeah. So this is the position actually we need to recognise that going through. Val's already mentioned we've asked for further proposals in terms of savings we can make going forward. So that gives an indication of what we have got to go at. There were a number of proposals that were made previously when we were talking about
this year's position, we didn't take them up at that stage. But we've also got to think about how do we build in sustainability to all things like community services, community transformation, and all that, because just doing improvement quality or improvement on, I suppose, activity on its own doesn't do. We've got to start to think how we make those sustainable parts of the overall piece. If I come to the two capital pieces afterwards, are there any questions on that before we go on to that? Are there any questions? Okay, so to talk about the two first, if you do the Highcroft one, we have spoken about it previously here. It was endorsed at FPP. So originally, the plan long term was to do quite a significant development on the Highcroft side, which would be replacing everything that's on the north patch, but in additional capacity. Because the constraints of capital nationally, what we have been able to do, and the only way we've been able to do this, is something about 25 million for 2 additional wards, so it's 32 additional beds. That's been, and the business case itself is in the reading room place that I'm already seeing it. That's been approved and will be funded by the ICB, who sees it strategically important. It's a straight substitution for out area, so it should help reduce that down, which is beneficial. There's things that have been added into the front sheet of that, which is open above what we talked about as FPP, so we asked for a range of things to be included in there. Happy to answer any questions on the detail, but this has been something we've been seeking for a period of time. It's a first step that does move us forward. It's been endorsed by FPP and the ICB. We're only waiting for confirmation from the ICB exactly how they'll cash flow. There has got some flexibility because they've got additional capital this year. The extension on this is likely to be more next year. There will be some this year, but that any construction would follow on from. Is there anything else that we covered to think about in terms of the discussion? Because there was quite a bit of twos and fro's about it.
No, not really. I think from most aspects, I think just in terms of the conversation at FPP for a report was around the outcomes. Whilst building a nice and shiny building, how does that then really focus on the outcomes? In terms of what pressure will it alleviate? I think we just need to make that a little bit more explicit in terms of how we tell the story.
Yeah, and it was very much. This is done for quality and service user perspective. It is doing. It's got financial implications. We're not doing it for financial reasons. There are gains, but it is because that we talked about before. So it should be a better experience. It's right. The model's got to go along with it. So the building itself doesn't necessarily change. It takes out some of the barriers in the current situation. It's worth recognising that. We do need to think about, as we said before, and we'll maybe come back to this thing about do we need some facility to be built in terms of food on this that we put in. I don't think we can do it in terms of just finding this stage around that. There are other options around it.
So just on that, this is going to create a further 32 beds.
Yes.
And what's the potential timeline for this?
That we're talking about, and I can't remember the details to be absolutely clear, but it's probably going to be, or it's tied into, trying to fit in with as the priority contract roll on would go through. I think it's slightly out on there.
Yeah, it's
but it
pretty
would be effectively about 18 months, something like that sort of order. There is a risk because we need to make sure we get the staff that's required to populate this as well. It is worth saying that we've been through at length with the clinicians, including nursing director, medical director, about the overall model of care, etc. We've got to think you have a look at this as well going through. So it's been in development over a long period of time.
Thanks, David. That's really helpful. So I assume that we've already started to kind of get the core production side of it.
It's been done as the thing, including the local community as well. So there's been quite a lot of work certainly done over this over the last 2 or 3 years.
So are you
looking for approval
for that? Can I ask on board board happy to approve?
Yeah, much needed.
Okay, okay.
Then going on to the one, as I said, we've already heard about this earlier on, as we talked about before, we've had significant expansion of the first in the forensic intensive recovery team in Secure, so that they've not had the capacity to do everything that's required, so they've not been able to have people fully there on an ongoing basis. Identified that also on that site, the main house as used to be, will be used for all this. So it's been developed through being, it was identified as the preferred solution, and you've got here the business case to go into that, but actually says this is what we want to do, we want to crack on with it, we need to crack on with it. It's in part of the overall repurposing of the capital programme described that in a minute, but because the value just needs to be proved here.
And again, are we, as a board, happy to approve or are there any objections? Happy to approve.
Thanks. And then the last one, and it's mentioned in the finance report on the capital page, including those two and other things that we've gone through, it's both rephasing, bringing forward, but also taking account of additional capital coming in as well. So we will still be able to live with the overall capital, but it's important we reflect this through the change on the split. What I propose to do, once we've got the other business case agreed with the next FPP, that we bring that overall, so we show the overall piece, but there are literally hundreds of schemes in the overall capital programme. So I'm just looking for approval to do that, pending it comes back with the full detail next month, if that's okay.
Okay, yeah, we're all happy to approve this. Brilliant. Are there any other questions for Dave?
Just a reflection really that, capital is as tight as about the tightest thing you can imagine right now. So I think the work that Dave and the team have done, because this has been ongoing for quite a long time, is actually incredible. Because they've been able to achieve something, the impact that this will have on service user experience, the staff being able to work in those environments and being a community resource will be
well done, everybody.
So I just wanted to ask Chair if we've got any indication of the number of staffing that will be required for the unit.
I'm going to see it here as a city, but that full detail is in the business case. So it's in the reading group, the high up one is within there. It's got the detail.
Thank you. Moves on. So thanks for that. Thanks, Dave. Can we call in Shane?
Morning, everybody.
Good morning.
Still morning. Do you want to carry on?
Yes, please.
Right, thank you very much for inviting me to your board meeting. Hopefully you read the paper and I'll take it as read it. So there's just really sort of a few highlights that I'm just going to mention. First of all, we're implementing two new systems. One is an estates management system, which is being launched in September. So that will allow trust staff to be able to view all jobs that are within our properties to understand the progress, understand if there are any issues with them and when they're actually completed. That will also give us more information with regards to how we report back to the trust with regards to our KPIs, our key performance indicators. The other new system we're implementing is a new food management system called Symbiotics. That's been quite a long process where we've had to redevelop and redesign all of our menus, and it's literally from the point that food comes into the trust all the way through to patients. Patients will also have the ability to now be able to order their food actually online. It will also give them all of the allergy information as well. So it actually means that hopefully it's a safer, a much safer system. We're continuing to work with the wider health system with regards to the ICS, and I think over the next few weeks and months that will progress further. And then with regards to our pharmacy, we're in the process of assessing a new robot. We bought a robot 8 years ago to do multi-dose trays, which was very successful. It actually released between 5 and 6 clinical staff back into the trust. 8 years on, it's now sort of coming towards the end of its life. We're looking at the new version of it, and we think there are some even more benefits to be had. But we're in that process of making that assessment. Hopefully we can commit to it before the end of this financial year. And probably last but not least, and obviously extremely important, is that SSL also did a staff survey of all of its staff, and we had over 75% of our staff replied. We had some exceptionally good results. I was personally surprised as well, but there's some really key things. So 80% of our staff really felt that their job was worthwhile, and over 75% of our staff felt that SSL was a great place to work. So we can give more information on that survey, but we were very pleased. That's it.
Brilliant, thank you. Are there any questions? Shane?
Yes, thanks, Shane. Really good report. A couple of questions. An observation on the staff survey. Phenomenal return on the survey. Is there anything that the trust can learn off the back of that? Number one. And then the second question is around the fact that we're heading into 2025. I know we're doing a sustainability framework and plan. We're quickly running out of runway potentially if we're all aspiring to the 2030 sort of milestone. But when are we likely to see the sort of sustainability metrics really coming into play and sort of having a significant influence in terms of how you sort of dial that up?
Okay, so two things. So the survey, I think we're in a fortunate position because we only have 380 staff, 390 staff. So we're able to engage with our staff on a more direct basis than I think the trust can. We gave over a month, so we gave a month to actually review it, and we also gave each of our staff dedicated time to fill out the survey. And we also provided the survey across lots of different platforms, so it was physical as well as digital. And if they did want help, then we could actually do that as well. So I think there are some good things that we did, and like I said, I think that level of engagement is really down to the fact that we were able to engage with our staff on a more direct basis. With regards to sustainability, we are looking, and we've been desperately trying to change our vehicles as one of our issues. So not all of our vehicles are either hybrid or electric, and when we've placed those orders, we're now being given over 12 months for delivery. So we have 13 electric and hybrid vehicles on order. And we're hoping that they will come before the end of this year. With regards to things such as our food management system, that will also help our sustainability, because it potentially has the ability to reduce our wastage and give us an opportunity to understand where we are wasteful. But yeah, I think we are working towards that.
I think actually we're quite a good position around that, and last time I spoke to you about it. So our performance against the levy is good already.
Sue and then Patrick.
Thank you, Shane. Looks like there's some great work. I've got a few questions, if that's okay. The first thing, we've mentioned a couple of times this morning around catering, especially on the north side of the city. So it's great to see that you're bringing in a new system and how that's being digitised. So I suppose my question is around looking at the dietary requirements, given the demographics of our service users, to make sure that for sure it's really that the dietary requirements and any other areas of needs are taken into consideration as options that's available for our service users in regards to catering and nutritional value as well.
Yes, and we don't do this alone. So we work and we work with the trust. So the trust have their own dietitians. So we work hand in hand. In fact, the trust has just appointed, or just in the process of appointing, a new food specialist, which allows us then to work with the trust so that we can ensure that all of those areas are covered. We've also, I spoke to Lisa a couple of weeks ago, and we were talking about food in the north, and we were talking about, we know that there's a different food process in the north. We're able to produce fresh food in our commercial kitchens, which are mainly based in the south, and in the north we tend to use a cook, freeze or cook, chill process. We have looked at options, and we are looking at options, and we're happy to present those to the trust. Obviously, there is a capital requirement and a cost to that, so we would then need the trust to obviously do the business case to actually do that. But we believe that there are some options.
Yeah. I think just hearing the story this morning about a pet service user that was limited on the options available for food and nutrition, I think.
I'll take that away, and if you can just let me know if there was a particular ward or particular area, then happy to do that.
The second thing I wanted to ask you, great that we're starting to implement technology in the pharmacy robotics. So I just wondered if you had any cost savings of the last 8 years of using this robotic in the pharmacy department, so that cost efficiency saving can almost be projected for the next upgrade.
Yes. So when we did the first robot, we estimated there was around £150,000 saving a year. That was purely sitting on staff, and we don't foresee. Obviously, that happened over the last 8 years. The new robot, the main difference between the new robot and the old robot is that where at the moment each of the trays are actually produced robotically, but then they're all physically checked by a pharmacist. The new robot the new style of robot has an automatic detection system which actually does all that automatic checking. So what we'd have to do is do a system check to make sure that it's accurate. But the manufacturers of this particular robot say that it's 99.9% safe.
Yeah.
So we just have to do
something through the loan operation at UHCW,
yeah,
and that uses barcodes to sort of scan accuracy.
Yeah, and this new one uses photographic evidence of each of the pills that goes in, and then identifies what's actually in the tray. So there may be additional savings for actually pharmacy checking.
Thanks. And then the third area is just, sorry, this one. We did the staff survey, great response rate, as Val mentioned. So I suppose my question is, in the survey, were there any questions around what can you do better?
Yeah, absolutely there was, and there was still some very important learnings to have. So a number of our staff voiced concerns or voiced an opinion that we probably, it's about their career path and how we could continue to train and develop people at all levels, and how we could give them a real understanding of what their career path is. I think as we get larger, I think this is partly down to the fact that we are a relatively larger business now. We're able to give people more and more defined career paths, but it's something that we need to know. In addition to the survey, we've also introduced an apprentice so we've got now 12 apprentices that are within our organisation, and we see that these apprentices can either be diploma or degree apprentices. So we're looking internally to actually promote those as well.
Thank you.
Thank you, Sue.
Yeah, thanks, Nick. Really good to read about the recruitment, but is in terms of your EDI interventions. Given early on we had a presentation on the workforce race equality standard and also the disability standard, it'd be helpful just to understand in future reporting what you would consider as your measures of success around EDI. Given we understand that there is a lot of work that you're embedding within SSL, it'd be good to actually see how you're measuring progress.
Okay, yeah, and I think you're right. I think we have as you know, we have a very strong EDI group within our organisation. We're looking to grow that, and we're looking to be able to utilise their skills across the whole of our organisation. So I'm happy to come back with some very clear sort of understanding of how we are promoting and how we, as you said, how we measure our success.
Shane, I think the report with factors is probably useful anyway.
Yes.
So the reporting is done on a regular basis as well. So
I can add that to the report because we do an internal report which allows us to show how our EDI advocates have supported our organisation as we move forward.
Do you have an EDI lead?
Yeah, no, we have. So actually, our comms lead is also our EDI. Actually, chairs who supports our EDI group. But we have an EDI forum where we have 12. I think it's 12 EDI advocates, which are effectively across the whole of our organisation. We're looking to grow that to over 20, and they meet on a quarterly basis. So we have a number of different subjects. We don't actually restrict to EDI issues. We have it as a wider. So they actually act as a staff forum as well. So because we felt that was probably a better way of having it in a relatively small organisation like ourselves.
I just wanted to ask about the sustainability. There's some really good initiatives that you're thinking of, and maybe there's something that we can also take on interest. And it would be good to hear the progress.
Yes, obviously I'll come back.
Thanks, Shane, that's great. Just reflecting on the use of the robot, because it's really given us some safety and monitoring around dispensing and distribution. Does your service bring back in the medications that are not used as well?
We don't, because what we tend to do is we, are you talking about disposal?
Yes, but disposal, non-collectives, that sort of, I'm just thinking about the scope of the electronic support system for practitioners.
So, the way our pharmacy operates is that we effectively dispense out to the to each of the teams, which will go out and dispense or dispense the drugs. If they're unable to do that, then they come back into the pharmacy. We then would reprocess them, but we wouldn't take it directly from the service user.
But if the service user hand collected, so I think we just could talk about that because it might be we can just enhance some of the safety along that whole cycle. Just in terms of non-collected items and returned items.
Yeah, we don't generally get service users collecting directly from the pharmacy.
I think it's done by the local ward. So it's about how you split the consumer.
It's about the non-collection and having a greater awareness.
Yeah. Okay.
Shane, thank you.
No problem at all. Thank you very much. So I'll take them so much of your time. Thank you.
Thank you. Nice to see you. So, Winston's not here, but obviously we have the audit committee's reports. Audit committee members are here. In relation to the report, are there any questions? There's not a presenter. Are there any questions on the report?
I think it probably just worth observing some discussions about what we've agreed that we're going to do that happened prior to it being presented anyway, was that internal audit would come to exec team on a regular basis, which would improve both communications working through. That seems positive news would help some of the, I suppose, the symptoms that we've got in here rather than anything else. That's the only thing I think that particularly I wouldn't look what's written there. Yeah, I mean, you're in that battle, so anything else there?
Can't think of anything else.
Just an observation that the conversation we were having earlier about cyber and IT and security, it's getting that assurance around having substantial assurance through that process is really important.
It is very much so. Are there any comments in relation to the audit process?
Thank you, Chair. Again, I'll take the paper as read. It gives a brief update of the meeting that was held at the end of July. In terms of alert, we're very conscious that due to financial pressures, there aren't any kind of funds available from the Trust for the development of the charity, which obviously will present ongoing financial challenges for us as well. However, in order to try and address that, I'd like to assure the board that we have set a time aside at the end of September to look at how we can develop, given the resources that we have internally, as in the charity itself, but also external opportunities that may be available in terms of funding streams that we might be able to tap into. We're also very keen to assure the board that whilst that development phase is taking place, we still are supporting applications that have been made by staff within the new guidelines that were agreed earlier in the year. We had a lengthy discussion about the events and engagement post, which was initially part of the infrastructure for 12 months, due to come to end in January, and it's funded externally through NHS charities. We have agreed that we will continue with that post on a permanent basis because we've been able to see kind of the impact that that's had and how that's been able, has enabled the team to kind of propel some of the for things that we wanted to do as a charity. So that will be an ongoing process. There was a presentation for further resource, which we said that we would agree that or discuss that at the away day at the end of September. And the other thing that I'd like to advise the board on is that there was discussion at a previous meeting around potential transfer of the investment fund from a multi-asset fund to a sustainable multi-asset fund, and that was agreed at the last board meeting. Happy to take any questions.
Just that's one thing. Actually, I don't understand the alert, because whether there's financial challenges or not, the trust shouldn't be funding and providing support financially to the charity. The charity. I don't understand the context of that.
I think it differs across the country, some trust owned. And there was a paper, as I understand it, that was presented to the trust before I started, and there's been a conversation around whether that could be submitted again. It hasn't been submitted again on the basis that actually we know as a trust that there won't be any financial support available, although previously there was some dialogue between whether the trust could fund what the charity needs. It's kind of come from legacy conversations, I guess.
Yeah, so I think it's a conversation we need to take into the workshop around whether there is appetite for investment in the charity. So certainly in the long term, the charity itself need to be sustainable, but not necessarily continue to fund certain costs. But I think it's a conversation that we need to have in the workshop that we really haven't had yet.
Any other questions? Sue?
Sorry, I just wanted clarification on what's the difference between the CMAF and the SMAF.
The main difference is around where the funds are invested, and it's more in line with charitable purposes, so it wouldn't invest in things like alcohol, tobacco, that kind of thing.
Thank you.
Excellent. Great. And it's good to see that we are still getting applications submitted under the new guidelines and that being highlighted. And we're seeing guidelines at significant events as well, sort of the medical celebration medical awards. I've got that right. And also our staff awards they were present, and it was good that they had a slot there as well. So we just need to continue to promote and highlight the work that they're doing.
There's also a presentation at induction as well now.
Yes, there is as well. Yeah, excellent. Brilliant. Thank you. Thanks, Monica. So we're moving over to the trust seal that we started.
Yes, just update on that, which is the reports come here because it's a constitutional requirement that each time or that the board is updated on the use of the trust seal. So this report indicates to us, informs the board that the trust seal was used on the 1st of July 2024. It was affixed to a lease which was around the electricity substation site at Parkview Clinic. So this is just to let the trust know that the seal is being used on that occasion. To let the board know.
And is everybody clear with what the trust seal is?
Need to get the wax candle out.
It's affixed. Each time it's affixed to a document, it's important that the board is notified.
Yeah.
Which is the constitutional requirement, which is what this just brings that to the notice of the attention of the board.
Yeah, we don't use the trust seal, but often,
yes.
But in certain circumstances, it is required, and this is the circumstance. But I thought, let me just mention it for those of you online watching and thinking, what on earth, what is this? Is it, I don't know, Dungeons and Dragons? No, we do that. Just traders. Thanks for that, David. There are no questions in relation to that. Okay, so that just brings us back to yourself, David, for the board effectiveness staff assessment.
Yes, the Board of Directors Effectiveness Self-Assessment is a requirement which is done annually. In terms of offering the board the opportunity to self-evaluate itself, to evaluate itself against how well it is functioning, it is constituted how well it is operating, what are its strengths, and what are the weaknesses, and what are the areas that it might have identified for improvement. So the Energy Board, the Healthy Energy Board, and the new Code of Governance for Energy Provider Trust have argued that the board needs to undertake a formal and rigorous assessments of itself as well as its committees, just to make sure that they are operating effectively and efficiently. So in terms of the survey monkey that's been suggested here, it's been structured under 5 key themes. The themes have been highlighted there in terms of board composition, board assurance, framework, board visibility, strategic performance, and leadership and shaping organizational culture. The ask from the board is to recommend the self-assessment for implementation, and also to identify what will be the preferred mode of implementation, paper-based or digital, or survey which will be digital, so that this could be implemented in the next coming weeks. Thank you. I will take questions.
Who's going to be directed to, who's going to complete it?
Yeah, there are 2 respondents, 2 groups of respondents. One is the 13 members who constitute the Unity Board, our Unity Board. Yeah, those are those that will very much encourage them to complete. And then there are the other group which are regular attendees, like some of us who regularly attend, who will also complete as well. But the focus of the analysis will be that of what the members who are the core members of the board, what they say, the 13 members.
So your ask was whether the option of digital or paper, I would have thought digital. Straight to
And then you must have had a look at the statements of the survey as well. And then the statements that you think need to be tweaked so that they make more relevant and they are more focused to reflecting what you do as a board, or are you in agreement that the statements are fine with you as well?
Can I just comment, based on the recent effectiveness survey we did at QFES, can it be created online that you can't click the end of it without writing some comments in the comment boxes? That other surveys that I've done doesn't allow you to complete a survey unless you've actually written something. Just to encourage a bit more of that quality.
Qualitative input, yeah.
As long as you don't write anything about me. Yeah, you can write good stuff. Yeah, I think it's a good idea. Sorry.
Could I just add to that as well? I agree, I think that there should be a kind of mandatory field. But I always have a bit of a concern with the neither agree or disagree, because I think we should all have some form of an opinion. And I wonder whether the neither agree or disagree could be amended slightly to say slightly agree or slightly disagree. So you've got 2 other options, take that one away. Because I can understand that you might not agree, you might not have a defined opinion because maybe you've not experienced it, or you've not been on the board long enough, and you've not been able to form a concise opinion. But the neither agree or disagree, I think, is a bit of a get out. I think we should be saying one way or another.
In terms of responding to that, the Likert scale uses different parameters. It could be the 5-point scale Likert scale, which is what we've gone for, or it could be the 7-point as well. It just depends on what we want to measure, how do we want to measure it, and how do we want that measurement to be undertaken. So I've opted for the 5-point. If we want to go with the 7-point, it just makes the whole thing very cumbersome and more confusing sometimes to analyze as well. But the 5-point makes it very streamlined, it's more focused as well. It takes us along a continuum.
So does it give you the opportunity the option to tweak?
No, it gives the option to be neutral. Yeah. It gives the option to add more points if you want to add more. We'll go up to 7. But it just makes the whole thing very confusing.
Could just think that if you had a lot of neither agree or disagree, it doesn't really give us much data. And that's the whole purpose of the survey, to give us that sort of narrative.
That's what it is.
Yeah, so if we have the narrative underneath it.
Just one the other alternative is we just don't put it in. So non-board put it in as an argument.
Yeah, go off the 4 point, yeah, 4 point on the next.
And then take it out, not just have 4 points, not having that one.
Yeah.
But there is a point there around within the literature, which means that when you're undertaking a survey, you don't need to mandate the respondent to take a position. The respondent may want to take a neutral position, where they do not have a specific opinion around the subject. So they neither agree nor disagree because they don't have a fixed position around the subject, probably because they're not knowledgeable enough or they don't have sufficient knowledge to enable them to take a position. So except you say that we need to compel them to take a position, which is quite challenging, in which case we go for the 4 point like that scale.
Yeah, thanks. So the first question, which is about just purely members of the board and those in attendance, in terms of the analysis, does it make any difference whether it's an exec or a non-exec, or you just
not actually included, so you have to say non-exec or whatever. At the minute, whatever you put here is what the analysis is going to be.
Yeah, but again, the unitary board, both the exec and non-exec are culpable. They are corporately responsible.
Yeah, that's the question I was asking, as in,
so it doesn't know.
As in, do we need that understanding?
I think it tells you additional stuff. If there's divergence between the groups, worth exploring. I would suggest we do it, but we recognise that actually we're both at that same level.
No, because it's the unitary board's effectiveness.
That's what I'm measuring. I'm not measuring perceptions between execs and non-execs, which could be a different conversation, which we want to do that. But again, we tend to pit the board against each other, which is not what we want to see. How does it function as a unitary body? What are the dynamics?
Well, I disagree with that. I think it doesn't push people against each other. What it does is show that there's a different perspective that you might want to do something about. I think it would be useful to collect, but bear in mind that actually it's the collective that matters, and if it gives us additional information, that's useful.
Yeah. I think it's how you interpret data to the reporting, isn't it? But there's a risk that we go with it and we say, well, if only if we'd ask the question. So you might want to have the data, but if you're reporting it here as a unitary report, that's fine. But I think it'd be helpful just to break it down in that way.
I suppose it's backwardly for our benefit, because this is a mandate to sort of regulatory requirements.
It just rather than if you want to use it, for example, in any of our development sessions, you can.
Yeah, okay.
I will.
Yeah. Great. Thank you. So that brings us down to Lynn Lisa.
Thank you very much for giving me the opportunity just to reflect on the first couple of months in the trust and some of the things I've seen. I've been around quite a few teams already, but in doing that, I've really tried to spend time with our staff, understanding what it's like for them to work in the trust and be in their teams, and talking to a lot of our patients as well about what it's like for them to receive care. And I think in terms of the values really coming through, one of the things I've personally experienced is the welcoming and understanding of me, yes, being an experienced professional, but in a very new context, in a very new place, lots of new people, lots of history I don't understand, and people really supporting me not to step in the balls overly much. So that's been really nice, and taking a lot of genuine thought and genuine care and compassion. I've seen some amazing communication between staff and patients, and in some of the unlikeliest places. And one of the things that really springs to mind is our services around our patients who are deaf, and their use of interpretation, but also staff who have that disability themselves, and really thinking about how they engage those services in activity, communication, expressing their needs and wants in a way that could really genuinely be met by the staff. And I've seen and felt the atmospheres on many of our wards to be quite lively, quite communicative, lots of interactions going on, even where there aren't organised activities, but still elements of normal socialisation going on, people listening to music, talking, playing pool, things like that. So there's been some real positives. And I've also seen some real compassion in some of our really tricky programmes that are very high risk. And if I think about RCRP, which is probably one of the ones that we are quite concerned about at the moment. Real thought and compassion in terms of the practitioners working in that urgent and emergency field, but also the partners that we work with, so compassion towards the police and understanding their position, compassion towards ambulance services and acute trust, and a real sense of people wanting to put themselves in the shoes of the other to understand what the pressures are coming from all places, and indeed in compassion about our regulatory colleagues and others that we might sometimes feel that's a little bit of a stretch. Team comes through really strongly as a fundamental principle of not just what people want, but how we sort of really build that collective consciousness about what's right in which in terms of things that we're doing as a trust, and what are the things that we want to move away from. And particularly out in the community mental health teams, I saw a real thoughtfulness about who are we today as a team, who's here part of things, where are we going, who are we seeing, what's the risk we're managing, people that are going out on their own, will we know where they are they looked after, will we look forward to seeing people coming back in again, sort of at the end of the day, and that sense of team when we're in dispersed services, I think is a real strength, and that inclusivity around that really came through, and staff have genuinely talked to me about recognising our positions of trust on anti-racism, on an LGBTQ first, and they've talked to me very openly about how different that feels now to how they've perhaps felt in the past or in other trusts that they've worked in. So that's come through really strongly, as did the joy I had at the Experts by Experience celebration and the best lemon drizzle cake I've had in my life. Which, you know, it's those little things, isn't it? It's those things that bring us together as human beings and that join us together. But the way in which corporate colleagues really took joy in coming and sharing their work with the Experts by Experience, and then that sort of frisson that you then immediately get to, oh, I want to do more with you, and how can we involve you in this, and how can we join together, sort of really came through wonderfully, and how we just, I think, continue to amplify team, and our service users, and I think really resonated with me. It made me feel really positive, and I think really came through from staff. And then just on the commitment piece, my goodness me, I have seen such talent in this organisation, in sort of going around the services and talking to people and meeting people who really know why they work in this trust and what's driven them to come to work in this trust and why they do the work that they do, and really feeling hopeful about the work that they do and positive about that. Really owning their services in incredibly challenging situations. You know, we've got areas that are under a lot of pressure, and yet they're in it every single day, and we keep coming back every single day with this sense of we're here, we're together, and it will get better because we're good people and we're working really hard and we're trying to understand what to do differently. So I think that bit about how people are owning their services, really want to own their improvement, and then work together to do that as teams with the patients has been a real sort of reflection for me about how that sort of comes together, and just that bit about how much hopefulness I've experienced, and that talent and energy, and that's just, it's made me very excited, it's made me feel very comfortable to be here, and you know, that then reflects on my own sort of use of my compassion, inclusion and commitment, and how I want to help people flourish in every way that they can.
Brilliant, thank you. Lisa, thank you. I love it when our board members actually give their reflections of trust values, and you give me yours of your initial time with us and what you've actually witnessed, what you've seen, and how you've been struck by some of the talent that you've come across, the events that you've attended, and also the fact, I think, I didn't say it explicitly, but I'm getting the sense of that sort of welcoming experience that you've encountered while you've been around, that the teams have actually welcomed you, embraced you, rather than she's the new girl.
Yeah.
Although, so that's really good to see. So thank you for that reflection on the trust values, which is really appreciated. And we come down to board assurance framework reflections. Is there anything from today which we've discussed and heard that needs to be in any way reflected in the back?
I think we did talk about probably on the development of a couple of things that the Victims of Services before. So I think we've already done that.
Yeah. Isn't anything else that I can think of? No. Any other business? Anything that I would just say, it's interesting hearing the reports that have been presented today, the CEO's report, talking about this, obviously, campaign since third phase, that's right, and also working with BSOL around the impending GP strike, what we're doing there, and also hearing from Dave in Machines report that we're still managing to fulfil our financial commitments that we have at this particular time, given we're in a very tight situation nationally and definitely locally, regionally, being part of being system partners, what's expected of us, and also hearing about the NMC independent inquiry report, and it's allowed us to just reflect about the welfare offer that we have for our staff if they're going to actually be taken through that particular process. Lisa made reference to, and I think I saw some photographs around the EBE event as well, which was a great experience. And also, again, to thank our machine mentioned it earlier about thanking our IT colleagues regarding the national outage, which was really important, and also the great news. I think we're going to give you more good news from CQC in relation to our eating disorders, and also lots of positive news today. It was referenced in your report, machine, around the Huntington's awards. They're doing some fantastic work, but there are other areas where we've been selected for national awards as well. So we need to be really proud of ourselves as a trust. We know that we've still got areas where, even from Vanessa, where we've got some particular challenge in terms of our spare replacements, but we're doing all that we possibly can on that, and I made reference about the IPR. We heard the assurance reports from people from Finance and Performance Committee, and also from QPED, and having Jazz coming and presenting the RES and the WEDES report, and seeing what further work we still need to do in that area, but just being assured that we are making some progress, not as fast as we possibly would like it to be, but progress is actually being made. So